Nekaj izjemnih strokovnjakov in poznavalcev področja zdravstvene nege se danes oglaša iz tujine. Prva vas bo nagovorila Elizabeth Adams, predsednica Evropske federacije združenj medicinskih sester.
Good morning, everyone, and thank you very much for this warm welcome to your conference. And it's with great regret that I can't be with you today to share, particularly in relation to International Nurses Day. So, Dorbadan colleagues and friends, and thank you, Madam President, and thank you also to the Slovenian Nurses and Midwives Organisation for inviting me here to present today. And I look forward to meeting you again one day in person. And of course, it would be very remiss of us if we didn't remember and reflect with sincere sadness. We remember our colleagues who have died and those who are ill due to their selfless commitment, care and compassion for all the citizens during the pandemic. And of course, we owe a very deep debt of gratitude to and our sincere appreciation to all our nurses and midwives in Slovenia for the risk that they've taken in relation to their lives and also that of their families and the unconditional care that they have given people in relation to saving lives and comforting people in their last moments here on earth. So it is with great sadness but great pride that we have seen how the amazing Slovenian nurses and midwives has responded to the pandemic. And of course, it's all about leadership and action. And you have the most fantastic leadership in the Slovenian Nurses Association. And of course, across all regions. And I have the great pleasure to working with your management team. And you can see the international impact that they have from not only the European Federation of Nurses, but also the International Confederation of Midwives and the European Association, also the International Council of Nurses, and the amazing work that Slovenia have been doing on the Nursing Now campaign. And I think you had a very successful Nursing Now challenge there in the last few days for young nurses. So many congratulations in relation to that. I do want to commend your president, Monica, who really takes on an enormous amount of work in leading the European Federation of Nurses. She is elected by 36 European countries to serve on the committee of EFN, and it's a 7-member team, and she has significant impact. And also Anita, who is always joins us at the European Federation of Nursing General Assembly. But the really important role that she plays is to ensure that in relation to midwifery, that our policies are aligned with the other work that's happening in relation to midwives across Europe. So we're very much influenced. We represent nurses and midwives, even though we're the European Federation of Nurses. And we represent 36 member countries, and we have 3 million nurses across Europe. Of course, Slovenia being really important. We're the independent voice of nurses, and we have a mission to strengthen the status and practice of the profession of nurses to benefit the citizens of Europe. And you can see that we work with the European Commission, the Parliament, and the Council of the European Union. And our lobby priorities include expenditure and efficiency, a shift to, of course, primary care, long-term care and aging and working conditions for nurses and midwives. And of course, with the Nursing Now campaign, which you have been very much involved in, the key messages in relation that you have been driving has been universal health coverage. And it's about investing in nursing and midwifery, maximising the scope and licence and the rapid cost effectiveness and high quality of universal healthcare going forward. And you have been progressing in particular terms, creating more nurse-led clinics, particularly in relation to NCHDs, enabling nurses to play a leading role in primary care, the development of midwifery and maternal, child and adolescent services, greater role in promotion and prevention of health literacy, and more specialist nurses in and out of hospital. And of course, we have enormous challenges, as we know, and WHO recognised that we would be 9 million nurses and midwives short by 2030. And now it's estimated that we're probably going to be about 14 million nurses due to the pandemic and the impact the pandemic has on the retention of our most valuable resources of nurses and midwives, which we're working hard on to retain. But it has been an extraordinarily difficult year going forward. And all the elements that feed into universal health coverage we work on. And even in relation to Dr. Tedros in the World Health Organization, recognize that governments must see jobs for nurses and midwives not as cost, but as a investment in sustainable development. And that's even more important now as we go into the post-pandemic period. And some of the reports that were guided our work on, we monitor and keep an eye on all of these European and global reports so that we can ensure that we have every opportunity to influence nursing and midwifery across Europe. And the OECD Health at a Glance 2020, it's a comparison analysis of health status of European systems. It goes across 27 EU member states and the 5 candidate states. And the summary of chapters this year, and it's an annual report, of course, there was a full chapter given to COVID-19 pandemic. And of course, while things have moved very fast, it is estimated that globally, and this is way underestimated, that about 2,500 nurses have died due to COVID and delivering care in their workplace. And as I say, that's a total underestimate because there's not systems in place properly to record it. But it's an estimate by ICN from feedback from national nursing associations. Chapter 2 then reviews the health and welfare burden of our population. And as we go into post-COVID, we will have to deal with all our usual issues that we have to face on a daily basis. And it's estimated that there's 168,346 deaths due to air pollution and health and welfare burden. Chapter 3 to 7 deals with the most recent trends, and it's about the risk factors due to smoking, which is estimated 700,000 deaths, alcohol and obesity, and that was particularly evident in COVID-19. It was one of the risk factors for COVID, reducing premature mortality, universal access to care, strengthening resilience, and in relation to effective spending, and of course, resilience across European systems. And we found that the European systems were highlighted to be very fragile during COVID-19. And health at a glance, the key messages, there needs to be more protection and prevention. 1.2 million people die prematurely every year, and that's not factoring in the loss of life due to COVID. It does give key elements within each country. And some examples, it says that Slovenia has the second highest suicide rate with 20 per 100,000 population. And the vaccination coverage has halved between 2008 and 2018. Improve access to healthcare, of course, universal coverage and the sustainable development goals, and a more resilient health system is identified as a key policy because 1/5 of health spending, which is average 8.3 of the GDP, is wasteful and could be reallocated. And some examples include some hospital admissions reflect failures in management of health problems in the community and consume over 37 million bed days each year across the EU. In relation to delayed discharges, they vary greatly across Europe, from 5 bed days per 1,000 population, and that's in Denmark, and I'll highlight my own country, Ireland, to 40 bed days per 1,000 population. And of course, the importance of the digital transformation of healthcare. And I have to say that your own president has been leading on artificial intelligence across Europe and the policies that drive that, and really excellent pieces of work that have been done in relation to deliver on that. One of the most important things for the Slovenian nurses and midwives need to be a part of a greater body of nurses in order that we can collectively influence and drive policies. And there is a policy system within the EU, and the Slovenian Nurses and Midwives Organisation, led by your management team, observe in relation to what is happening in relation to policy terms. And this European semester brings the policy together with the financial outlook. So it's a really important monitoring role that ensures that the voice of nurses and midwives in Slovenia is put into the policy development and then is funded for the future. And because of COVID times, there's a new element, the financial support in relation to the Recovery and Resilience Facility. And you can see there that there's 672 billion available for that. And if nurses don't step up and midwives and have their voice heard in relation to what needs to be done with that money to support nurses and midwives and frontline nurses and midwives in delivering care, it'll go to other sources. So it's vitally important that your representation, which does an extremely good job, is at the forefront at Europe, influencing the European institutions. One of the other important policies in Europe is the European Pillar of Social Rights, and it talks about better working and living conditions. And it has 20 principles, but the 4 principles that we work on your behalf is education, wages, healthcare, and long-term care. And it's about equal opportunities and access to the labour market, fair working conditions, and social protection and inclusion going forward. And of course, we have the opportunity as the European Federation of Nurses, and because you are at Monica is on the actual executive committee of EFN, she has regular communication with the commissioners. We have access to the commissioners to state the case in relation to the requirements of nurses and midwives in Slovenia. And all of these are accessible on the European Federation of Nurses website. We also had an excellent meeting earlier this year with Commissioner Smith from DG Employment, and we have a number of reports, not only in relation to COVID, but also in relation to long-term care. And again, Monica, with the support of Anita, presented in relation to the importance of long-term care and the impact going forward. And Commissioner Smith was really taken, and he did express that it's not how the health system can be organised. It is not understandable that the work of those taking care of well-being of others is so undervalued, and he understood that going forward. So in relation to the policy drive, before the pandemic ever came in, there was a global vaccination drive to improve vaccinations. WHO had declared vaccine hesitancy to be one of the 10 threats to global health in 2019, just before the pandemic. The European Commission established the Coalition for Vaccination, of which EFN is a chair with the European doctors and pharmacists. And it's a really prestigious position for nurses and midwives to hold. And it's based on the European Council recommendation, which has 3 pillars of tackling vaccine hesitancy, sustainable vaccination, and European coordination and contribution to global health. As I said, it's in relation to all vaccines, but does cover the COVID vaccine. And the reason why this came about, that they found that vaccinations prevent 2 to 3 million deaths a year, with a further 1.5 million with improved uptake. And 1 in 1,000 cases of measles is fatal. And in 2018, when this policy was coming into place, 72 children in Europe died from measles in 2018. And they say that after clean water, vaccination is the most effective intervention to saving lives. And the European Federation of Nurses also partakes in a number of very important European Commission projects, and immunisation is one of them, and it's a project that's only started. It's about building and learning from vaccination efforts at national, regional and global level. And of course, the very successful QuadMed that you know more about than me. It's about the quality mentorship for developing competent students and the incredible work that the College of Slovenia have done in relation to that project. And it will have an impact all over Europe. So really leading the way in relation to how policy is shaped in Europe going forward. And we have a number of Horizon 2020 funded projects that we also are involved with and we're a partner of. Smart for Health and EHR rate to provide European citizens with access and control of their health histories, with an option to be able to share the health services and research. And it's just to give you a sample of what the European Federation of Nurses is involved in. Now, we have a lobby role in relation to the European Health, and what is very important, and we're very aware that there needs to be a very strong research basis. So we have a separate arm that we have developed, which is the European Nursing Research Foundation, and we have the governance in relation to that. So your members oversee the governance of this organisation, which is led up by Professor Dr. Anne-Marie Rafferty, who is the president of the organisation, but EFN is the oversight body in relation to governance. And just in the last month, they have done some amazing work in relation to policy briefs, which are all available, and position statements. And they cover many things in relation to, outcomes due to care left undone, empowering nurses due to digitalisation, and of course, the frontline nurse education and mentorship, which was inspired by the work that has been done in Slovenia going forward. And just to say, we're all so very proud of not only all of you nurses and midwives in Slovenia, but in all our European countries. And in 2020, you all received the Woman of Europe Award, which was jointly organised by the European Movement of International and the European Women's Lobby. And it was in the Women of Action category that you were awarded great recognition for your dedicated and commitment to delivering during the COVID pandemic. So just really want to say that, people, you are recognised all over Europe in relation to the incredible work that has been delivered. And of course, it'd be very remiss of me if I didn't say, as we know, that it was the celebration for midwives on the 5th of May. So just to wish everybody another good year and productive year. And of course, the International Day of the Nurse is the 12th of May. And we really do need to take a moment to celebrate and recognise all that's achieved in order for us to be inspired for going forward. So that leads me to the end of the presentation, just to say thank you so much for the opportunity to present to you today. And of course, please take care and stay safe. And I wish you every success with the fantastic conference that has been put together for you. Thank you.